Hey, my name is Steven, and I'm going to be going over the case study of Rudy and what exercises I would prescribe to him and why. So, the main problems associated with Rudy I identified using the American College of Sports Medicine guidelines for risk factors associated with cardiovascular disease. These factors include his age, his obesity, the fact that he's diabetes, and so many others. The priorities I set for this case, though, were based off a study done by the Institute of Cardiology that claims obesity to be associated with many of the same factors of cardiovascular disease that Rudy suffers from. Based off of this study, by making obesity one of the priorities for this case, I will be treating one of the underlying causes for most of the comorbidity Rudy has. The American College of Sports Medicine also supports physical activity as prescription for obesity and many of the other comorbidities present in this case. So, along with obesity, I'm also going to be prioritizing increasing Rudy's physical activity levels. The Swedish Quarterly Register for Pain Rehab conducted a study that showed low physical activity levels and obesity to be related with high mechanical pain, activity limitation, and low function capacity. This is a chart from the study that has the BMIs of the participants and what they would be categorized as based off that BMI. As you can see, the more severe the obesity was, the more pain and less physical activity those participants did. The American College of Sports Medicine also mentioned that older adults are more susceptible to low max heart rates, lower muscular strength, and lower cardio output. These studies show that Rudy's obesity and low physical activity can limit his overall mobility and the kind of intensities he can endure. So I made sure to consider these things when I was considering exercise program. When I started constructing Rudy's exercise program, I used the Journal of Exercise Physiology, which conducted a study that found resistance training, aerobic training, and a better diet, all things that Rudy needs to improve on, can help with the weight loss in older overweight adults. As you can see from this data from the study, there was a significant decrease in participants' BMI, body weight, fat mass, and fat percentage. Since the results kind of speak for themselves, I decided to adopt most of the exercises from this study. These exercises include rowing, cycling, and shrimp training for the legs, and I'll go over for them in a future slide. These exercises were made using the American College of Sports Medicine's protocol for obese patients, so I only had to make minor adjustments because they were already made for a population similar to Rudy's. Now, a big thing that I did change from the exercises of the previous study was how long Rudy would be doing aerobic activity. A study done by the International Journal of Exercise Science found that aerobic exercise that were distance-based instead of time-based yielded greater results in weight loss. As you can see in here, the group that had a limitation on the aerobic exercises based on time had worse results in weight loss compared to the group that limited their exercising to a certain amount of distance. Body fat percentage, body mass, and fat mass all decreased throughout the distance-based group in the post-screening, but not in the time-based. It actually increased slightly. Because of these results, I decided to use the distance-based training for my aerobic portion of the exercise instead of the guidelines of the American College of Sports Medicine that usually uses the time. You can see right here my 3-week program that I have out for Rudy. As you can see here, the time for the aerobic portion is 5 miles per week because I want to do distance based instead of time based. Everything else was made using the American College of Sports Medicine's guidelines for obese patients.